without sufficient dilation, you cannot perform these procedures. And they use laminaria just like we do for first and second trimester abortions. But because of the degree that the cervix has to be dilated for one of these very late-term abortions, it takes 3 days to accomplish the dilation. And even in his paper, he says dilate the cervix with laminaria. The next line says dilate the cervix more. And the next line in capital letters says dilate the cervix more. It takes 3 days to accomplish sufficient dilation to do a partial birth abortion or a D and X abortion. And I always bring this, and when I'm speaking about this, I make sure people understand why it's a joke that this procedure is useful for saving lives. And I said this a little aside, but I thought it was worth talking about. I worked for the last 7 years of my career prior to moving to Las Cruces, New Mexico 8 years ago, I was working in a tertiary referral medical center where the highest risk pregnancies were brought. Women with severe problems, severe toxemia, diabetes, heart disease, conditions where truly if the pregnancy was not ended, the woman would die. No question. None of these mushy social reasons for abortion. We're talking about life and death here. And I always remember, I always use as an example, one lady that came in, her blood pressure, she was 29 weeks pregnant, her blood pressure was 220/140 when she was admitted. Protein off scale, severe preeclampsia, obviously. And here's a woman where the pregnancy must be terminated, the pregnancy process must be ended, or she is going to be dead. And I'll present this to even students and tell them now, if we wait, so here's a perfect example, we're going to use, let's say we decide to use partial birth abortion to save her life. If we have to wait 3 days to accomplish the delivery, the portion of the hospital where she will be located is no longer the delivery room, it will be the morgue. It's exactly why partial birth abortion is worthless for saving women's lives when you have serious medical problems. What you do is you stabilize the patient and you get her delivered. And hers was a perfect example of that, and delivered a perfectly healthy little girl that we still hear from all these years later. Partial birth abortion is worthless for saving any women's lives because of the amount of time that it takes. And again, the amount of time it's taking is because of the need for laminaria. We always hear about abortion being a choice. Yes, women make choices. Of course, we all make choices in our lives, and some of them are good and some of them are bad, and abortion is a perfectly good example of that. But a lot of women who choose abortion subsequently choose not to abort. In most situations, if she's involved in a chemical abortion with RU486, once those pills are taken, there's pretty much no return on that one. And of course, with the suction BNC, the procedure is pretty self-contained. It's going to take about 15 minutes, and again, it's all going to be over. But when laminaria is involved, and that's in a lot of abortions, 10% of all abortions in this country are second trimester or later. And virtually all of them are going to involve the use of laminaria. And you're going to have at least 24 hours between the time this procedure is initiated with the laminaria and the actual DNC procedure or D&E procedure is performed. Sometimes longer. And many of these women are going to change their mind. I certainly ran into them in my practice. So the question becomes, when a woman has had laminaria inserted, can it be removed safely? Can you do that? Now I don't know, I've heard there have been some experiences in this hospital, maybe somebody can relate to me exactly what's happened here as by way of discussion. Can somebody tell me about some of the cases you've seen?
It was at St. Mary in Nazareth, which is part of the resurrection system. And women from the Women's Center would bring patients. Actually, it started with a phone call. I was delivering babies at home. And so the Women's Center called me and said, we'd like some laminaria removed. I said, well, what are laminaria? Now you've told us it's a tent. The reason I called it a tent was because with the first time I took some out, I had worked on an Indian reservation when the Korean War was over out in South Dakota. And so I saw real tents, teepees. So they made they took lumber or logs or whatever it is and like sticks that you're talking about, but they were all tied together at the top where the chimney came up. So when I took this thing out, I said, oh, that's why it's a tent, because like you say, there's these thin sticks, but they're all tied together at the top. So in any case, that's how I got started. It was a phone call, and I said, well, I had worked in 1960 at the Cook County Hospital, which at that time delivered all the babies in Chicago that were on relief, because there was only one Cook County Hospital, and public aid and Medicare hadn't come in.
Sure.
So the obstetric specialty people had 1-year OB residencies and sometimes 1-year surgical residencies around the country. So I ended up at a 1-year residency at OB at Cook County. The wards had 60 people on them, and there were different parts of the training, but one part was 24 hours on, 24 hours off, of people who came in hemorrhaging. And it wasn't clear whether they had a miscarriage or not. You just watched them overnight to see whether something would come out, and in the morning you put them up in stirrups and you put dilators in genteelly, and if you couldn't get it in, you presumed there hadn't been a miscarriage.
Sure.
Except as a young doctor, I was very disappointed sometimes when there'd be and water would come out, and I realized that I had been part of an abortion.
Sure.
My conscience was clear that it was not what I was up to. So that's how, when they called me and said, take laminaria out, I thought, well, with that stuck soup, I was exposed to it from the other end, trying to avoid abortions. I don't mind pulling them out.
Sure. I think that there may be some natural reluctance on the part of some physicians. They're concerned, here's a procedure underway and they're, quote, interrupting the procedure, or they may be concerned about complications, or they may be concerned about legal repercussions. All of us think about these things, obviously, when we're involved with patients. There is plenty of literature. The fact of the matter is that laminaria can and should be removed if a woman changes her mind. It's pretty simple. The laminaria sticks have a string attached to them, and usually it's nothing more than grasping a hold of the string with a Kelly clamp or a ring forceps and removing them. Simply no different than you would remove an IUD or any other device that was sitting inside the cervix. And usually it's very simple operation. As I said, literally get a hold of it and just extract them gently but steadily. More often than not, the laminaria will come out in a clump. They are not tied together, but they usually have a tendency to stick together, and usually they'll just come out in one group. Now, the point being that if you run into this situation and you're worried about removing these things, just remove them. I think that it would be wise, and if this is going to be something you're going to be seeing, it may be prudent for the hospital to come up with some kind of consent form for removal of laminaria and talk about some of the possible complications. But there's absolutely no reason these can't be removed. I've done it on many, many occasions. Obviously, I removed them all for the abortions I was doing, but there were several situations where I had patients change their mind and simply remove the laminaria. Provide the patient with antibiotic coverage. And I will tell you from experience, the vast majority of the time, nothing's going to happen. I was doing a little bit of research for this. I came across a court case. Their laminaria was a central part of the court case. And they included the consent form that the abortion clinic, this particular one happened to be in Dallas, was using. Big black letters, by signing the second trimester consent for abortion and laminaria insertion, it is understood that you are aware, understand, and agree to the following. Laminaria insertion begins the abortion process, true. You must return to this office at the designated times. You must stay within the area until the abortion is complete. And then it states, removal of laminaria at patient's request and against medical advice may cause bleeding, cramping, fever, infection, spontaneous pregnancy loss, and other complications. I looked at that and chuckled a little bit. I said, well, it's not the removal of the laminaria that causes those problems. It's the laminaria that causes those problems, as a matter of fact. Certainly there's a risk of infection. Certainly there's a risk of spontaneous rupture of membranes, not by the removal, by the mere presence of the laminaria. And there's a risk of miscarriage. Certainly the patient needs to be aware of those things. And if you'll find, probably, if you look at the consent forms they signed before they had the laminaria inserted, those things were already spelled out. And I think patients should be clear. But what real risk does she follow by removal of the laminaria? Not really. You haven't added anything, in my opinion, by removing